Last September, I almost lost my own father to something I never in a million years saw coming. It wasn't a surgical mistake, and it wasn't some obscure genetic disorder we failed to diagnose. It was complete ignorance. I've worked as a practicing cardiologist for 17 years. I performed more than 2,400 invasive cardiac procedures. I've published clinical research, lectured at international medical conferences, and saved lives in the emergency room at 3 in the morning when every single second mattered. My father called my cell phone at 7:22 a.m. I remember the exact timestamp because I was in the middle of drinking my morning coffee, reviewing patient charts before driving over to the hospital. "Son," he told me, his voice strained with a strange tension I'd never heard before. "I feel dizzy. My heart is racing, and something just doesn't feel right." Now, you have to understand something about my dad. He is not the kind of man who complains. He was raised in a generation where you tough things out in silence, where you never call your busy doctor son unless something is genuinely wrong. But I dismissed his concerns. I told him what almost any cardiologist might casually say to a parent who just woke up feeling a little off. "It's probably nothing, Dad. Your heart is just adjusting to waking up. Sit down, drink a glass of water, take a few slow breaths, and it'll pass." I was so completely convinced by my own casual diagnosis that I didn't even think to tell him to call 911. Exactly 48 minutes later, my mother was screaming into the phone. My father had collapsed on the kitchen floor. His lips had turned blue, and she couldn't find a pulse. The ambulance reached their house in 6 minutes, and the paramedics worked aggressively on him for 12 full minutes before they finally restored a stable cardiac rhythm. 12 minutes! Do you have any idea what races through your mind when you're a cardiologist and you're told your own father's heart stopped beating for 12 minutes? Every worst-case clinical scenario you've ever studied suddenly has your father's face on it. Every statistic becomes deeply personal, and every percentage becomes a desperate prayer. I met the ambulance at the emergency department. I watched the trauma team frantically work over him, and I stood there in my white coat with all my medical degrees and surgical credentials, completely powerless, a helpless spectator during the most critical moment of my entire life. The attending ER physician, Dr. Eduardo Perez Alba, a close colleague I'd worked alongside for years, pulled me aside into a quiet hallway once they finally stabilized him. Her expression was dead serious, that heavy, guarded look doctors only use when delivering difficult realities. She asked me a single, simple question that completely changed everything. "What was your father doing this morning right before the symptoms started?" I had no idea. I immediately called my mother. She was still trembling from the shock, but she walked me through his morning routine with the exactness of someone who had watched the same daily ritual for months. "Nothing out of the ordinary," she said. "Just what he does every single day. The exact same routine for the past 8 months since he retired." And that was the moment the truth hit me like a freight train. His everyday routine wasn't the issue. The specific timing of that routine was a ticking time bomb that had finally detonated. Before I explain the details, I need you to do something for me right now. Leave a comment below and tell me the very first thing you do the moment you wake up in the morning. Don't write what you think sounds healthy. Write what you actually do every single day. I'm completely serious. Type it out, because what you are about to learn could save your life. But only if you are completely honest with yourself about your real morning habits. My father survived that morning. Following 3 days in the intensive care unit and 2 weeks of difficult hospital recovery, he was finally discharged home. But he is not the same man he was before. He has to live with the heavy knowledge that his heart completely stopped, that he was clinically dead for 12 minutes, and that his brain was entirely deprived of oxygen while paramedics repeatedly shocked his chest, desperately fighting to restart an engine that had been running continuously for 68 years without a break. And the most painful part of all, the realization that keeps me wide awake at night, is that it was 100% preventable. Since that terrifying morning, I have become completely obsessed with this topic. I have personally interviewed over 180 patients who survived sudden morning cardiovascular events. I've combed through every single published study on circadian cardiology, chronobiology, and vascular timing I could get my hands on. I've spent hundreds of hours analyzing medical data that most cardiologists never look at, because our entire medical system is trained to treat cardiac disease after it happens, rather than preventing it before it strikes. Through that research, I uncovered something the medical community is only just beginning to grasp. There are 5 specific, common morning behaviors that create a catastrophic cardiovascular storm in adults over 60. These aren't obviously dangerous habits on their own, and they aren't things that would trigger alarms during a routine checkup. But when you perform them during the very first hour after waking up, when your cardiovascular system is already under its highest physiological strain of the day, they can literally stop your heart. My father was making one of these exact mistakes every single morning. And based on all the clinical data I've gathered and the hundreds of patients I've interviewed, there is a very high probability that you are making at least one of them as well. If you are past the age of 60, or if you have parents or a spouse over 60, I urge you to subscribe to this channel right now. Click that subscribe button because the rest of this video contains information that could genuinely keep someone you love from becoming another morning cardiac statistic. You might tell yourself you'll come back and watch this later, but we both know how the internet works. You'll scroll away, the algorithm will bury this video, and the person who desperately needs this warning will never see it. Subscribing right now ensures this vital information reaches the families who need it most. Let me break down exactly what happens inside your body the second you open your eyes in the morning, because once you understand the underlying physiology, everything else will make total sense. Your body does not transition into wakefulness like a smooth dimmer switch. It practically detonates. First, your circadian clock triggers an explosive surge of cortisol, your primary stress hormone. Within 15 minutes of opening your eyes, your circulating cortisol levels surge by 50 to 60%. This is not a gentle morning wake-up. It is your endocrine system slamming the accelerator to the floor, driving your heart rate up and aggressively constricting your blood vessels. Second, your autonomic nervous system abruptly flips from parasympathetic rest and digest mode straight into sympathetic fight-or-flight mode. Adrenaline floods your bloodstream like a tidal wave, causing your blood pressure to spike by 10 to 20 points, and often significantly higher in just a matter of minutes. Third, after going 7 to 8 hours without a single drop of fluid, you are in a state of severe overnight dehydration. Your blood has transformed from a smooth, free-flowing liquid into thick, viscous sludge, forcing your heart to work 3 times harder just to push that heavy fluid through your vascular network. Now, picture an aging cardiovascular system, a heart that has been beating faithfully for 60, 70, or 80 years, suddenly forced to navigate this biological tempest. You have arteries that are naturally stiffer with age, blood vessels that adapt far more slowly, and vascular tissues carrying decades of wear and tear. Now imagine layering stressful, disruptive physical habits directly on top of that natural hormonal surge. That is precisely what my father did, and it is what millions of seniors do every single morning without realizing they are playing Russian roulette with their cardiovascular system. The first deadly morning mistake is something 87% of people do completely on autopilot, leaping out of bed the second the alarm goes off. You hear the chime, your eyes pop open, and instantly, as if responding to a house fire, you swing your legs over the mattress and stand straight up. You are walking across the room before your brain is even fully awake. It feels productive, it feels disciplined, and it seems like the hallmark of an energetic person. But for anyone over 60, that sudden upright movement can trigger acute orthostatic hypotension, a dramatic, precipitous drop in blood pressure that leads to fainting, severe falls, and, in worst-case scenarios, fatal cardiac arrhythmias. Here is what physically happens inside your body. After lying flat for 8 hours, your blood is evenly distributed across your circulatory system, with gravity exerting zero downward pull. The instant you stand up abruptly, gravity violently drags up to 1 full liter of blood down into your lower extremities and abdominal cavity. 1 entire liter. That represents a massive, sudden drain of your circulating blood volume in mere seconds. Your heart suddenly has significantly less blood available to pump up to your brain, and unlike your skeletal muscles, your brain cannot store oxygen for even a few seconds. Every moment of reduced cerebral blood flow begins starving and injuring brain cells. In a younger person, microscopic pressure sensors called baroreceptors detect this pressure drop instantly, signaling the heart to beat faster to compensate before you even notice it. But as we age, these baroreceptors become sluggish and desensitized, behaving like old smoke detectors running on dying batteries. A dangerous lag develops between the sudden blood pressure drop and your body's ability to correct it. During that delay, your brain is starved of oxygen. You feel dizzy, your vision dims, you see spots, your legs turn to jelly, and in severe cases, you lose consciousness and collapse. Falls are among the leading causes of fatal injury in older adults, resulting in fractured hips, traumatic brain injuries, and massive internal bleeding. And a huge proportion of these falls occur during those first few minutes out of bed due to orthostatic fainting. But the biological danger extends far, beyond the physical fall itself. When your body finally recognizes what is happening, when those sluggish baroreceptors finally sound the emergency alarm, it overreacts in a blind panic. Your nervous system dumps a massive burst of adrenaline into your bloodstream to force your blood pressure back up. Your heart instantly transitions from struggling to find blood to suddenly being forced to pump violently against skyrocketing vascular resistance. This creates a dangerous condition known as reflex tachycardia. Your heart rate accelerates violently, like a cold engine being revved from idle to redline in half a second. In an aging heart already strained by the morning hormonal surge, this violent acceleration can instantly trigger fatal electrical arrhythmias like ventricular fibrillation, leading to sudden cardiac arrest where a person is clinically dead before their body even hits the floor. The medical solution is remarkably simple. When your alarm goes off, remain lying flat for 30 to 60 seconds. Take 5 slow, deep, diaphragmatic breaths to signal to your nervous system that you are safe. Then, sit up slowly and rest on the edge of your bed with your feet flat on the floor for another full minute. Gently rotate your ankles in circles to activate the calf muscle pumps that physically push pooled blood back up toward your heart. Only after those 2 minutes should you stand up slowly. Those 2 extra minutes are often the sole difference between an ordinary morning and an ambulance parked in your driveway. Tell me in the comments right now, do you normally jump straight out of bed, or do you give yourself time to wake up gradually? Be completely honest. There is no judgment here, only awareness. The second deadly mistake that almost nobody thinks about is failing to drink water immediately upon waking. Most people walk straight to the coffee maker, head to the bathroom, or pick up their phone and start scrolling through news feeds. They completely ignore the fact that their body has just spent 8 continuous hours losing moisture through breathing and sweating. Every breath you exhale releases water vapor, meaning that by the time you wake up, you are in a state of marked physiological dehydration. This triggers severe hemoconcentration. Your total plasma volume shrinks while the concentration of red blood cells, white blood cells, and platelets remains the same, leaving your blood thick, sticky, and highly prone to clotting. Picture your heart trying to pump thick honey through a network of narrow pipes instead of clean water. That is the exact mechanical strain your heart endures every morning when you skip immediate hydration. It has to generate significantly higher pressure just to push that sluggish blood through your arteries, dramatically multiplying cardiac workload right when your heart is already under peak stress from cortisol and adrenaline. But thick blood isn't just hard to circulate, it is the ultimate catalyst for the arterial blood clots that cause sudden heart attacks and strokes. When blood is viscous, platelets become hyperadhesive, sticking to one another like tiny magnets. If you have any pre-existing cholesterol plaque inside your coronary arteries, these sticky platelets rapidly pile up against the vessel wall, forming a clot that can completely occlude the artery within minutes. This is the exact physiological cascade behind the vast majority of fatal heart attacks. A thrombus forms over an unstable plaque, completely choking off blood supply to the heart muscle. And it is no statistical coincidence that the overwhelming majority of heart attacks occur in the early morning between 6 a.m. and noon, precisely when blood viscosity and platelet stickiness peak. The medical data is alarming. Your risk of suffering a heart attack is 40% higher during the morning hours than at any other point in the day, while stroke risk jumps by 49%, all driven by the lethal intersection of thick blood, dehydration, surging cortisol, and elevated blood pressure. The fix is so simple it almost sounds too easy. Place a large glass of water on your nightstand before you go to sleep. Make drinking 300 to 400 milliliters of room temperature water your absolute first priority the second you wake up, before checking your phone, before heading to the bathroom, and before taking a single sip of coffee. This simple action immediately reverses hemoconcentration, rapidly expanding your plasma volume, thinning your blood, easing the workload on your heart, and dramatically lowering your clotting risk within minutes. The third deadly mistake is something roughly 80% of adults believe is essential to function: drinking strong, concentrated coffee on a completely empty stomach immediately after getting out of bed. This is a cardiovascular landmine disguised as a cozy morning ritual. I love coffee, and I am certainly not telling you to give it up forever, but the timing and context in which you drink it can be the difference between a harmless morning pleasure and a fatal cardiac trigger. Caffeine is a potent central nervous system stimulant that prompts a massive release of adrenaline from your adrenal glands, causing rapid heart rate acceleration, peripheral vasoconstriction, and a sudden sharp spike in blood pressure. Remember, your body is already managing elevated cortisol, thick dehydrated blood, and the intense autonomic transition into wakefulness. Your cardiovascular system is already running at peak capacity. Adding a direct caffeine shock on top of that is like throwing lighter fluid onto a blazing fire. For a 25-year-old with soft, elastic arteries, the body can usually absorb that extra stress. But for a heart and vascular system that has been beating for 6, 7, or 8 decades, with stiffer arterial walls and undiagnosed coronary plaque, this sudden stimulation can trigger lethal arrhythmias, severe hypertensive spikes, or acute myocardial infarction. When you drink coffee on an empty stomach, caffeine absorption is accelerated dramatically because there is no food to slow its transit. Peak caffeine concentrations hit your bloodstream in just 15 to 20 minutes, instead of the normal 45 to 60 minutes it takes with food. This creates a severe caffeine shock. Your vascular system is bombarded with a stimulant right at its most vulnerable hour. Blood pressure can easily spike by 20 to 40 points in minutes, heart rate accelerates rapidly, and your heart enters a state of electrical hyperexcitability, where any sudden movement or stress can trigger a life-threatening arrhythmia. I have reviewed autopsy reports of patients who suffered fatal heart attacks within 30 minutes of drinking strong coffee on an empty stomach. The coffee didn't create the plaque, but it was the final trigger that caused it to rupture. The clinical solution: if you cannot imagine starting your day without coffee, never consume it on an empty stomach. Always eat something first, even just a banana, a piece of toast, or a small handful of walnuts, to slow absorption and buffer your system. If you drink concentrated espresso, switch to regular drip coffee. Cut your intake down to a single cup and always drink 300 to 500 milliliters of water before touching caffeine. Hydrate your bloodstream first, always. I want you to write down in the comments honestly, how many cups of coffee do you drink each morning, and do you eat food before your first cup? Awareness is the very first step toward protecting your heart. The fourth deadly mistake is something many people do believing it is the pinnacle of health: performing intense cardiovascular or heavy-strength workouts during the first few hours after waking up. Running, heavy weightlifting, high-intensity interval training, or intense spin classes right out of bed force your heart rate to skyrocket before your vascular system has adapted to being awake. Let me be completely clear. Exercise is fundamental for cardiovascular longevity, but exercise timing is critical, especially past age 60. In the early morning hours, your heart is already battling multiple compounding stressors: surging cortisol, elevated adrenaline, thick dehydrated blood, higher baseline blood pressure, and cold, stiff blood vessels. Forcing intense physical exertion onto your body at this exact moment is like taking a car engine that is already redlining and slamming it into a higher gear. Your heart, which is already working overtime just to navigate the waking transition, is suddenly forced to pump massive amounts of blood to working skeletal muscles. Myocardial oxygen demand surges to levels that narrowed, aging coronary arteries simply cannot satisfy. The danger multiplies exponentially when people work out while fasted and dehydrated. Rolling out of bed, throwing on gym clothes, and running out the door without water or food forces your body to break down muscle for energy, dumps even more cortisol into your heart bloodstream, and causes blood sugar crashes that place extreme stress on the heart. Combined with thick, sluggish blood, this creates the perfect physiological recipe for sudden cardiovascular collapse. Many tragic cases of sudden cardiac death on morning jogging trails or in gyms happen for this exact reason. Healthy-looking people stacking multiple hidden risk factors into a lethal combination. The solution? If you prefer morning exercise, wait at least 2 to 3 hours after waking before doing anything intense. Give your body time to transition smoothly, hydrate thoroughly, eat a light snack to stabilize blood sugar, and allow morning stress hormones to settle. Always dedicate at least 10 to 15 minutes to a gradual warm-up, and consider shifting your most intense workouts to the late morning, afternoon, or early evening when your cardiovascular system is far more resilient. Now we come to the fifth and final mistake, the exact habit that almost killed my father. Before I reveal it, if this information has brought you value and helped you understand the hidden risks in your morning routine, please hit that like button right now. The reality of modern media is that if viewers don't engage, the algorithm buries this content, and the older adults who desperately need this warning will never see it. Liking this video is how we ensure this message reaches the people whose lives it can save. The fifth mistake is the most devastating of all. It is something wellness influencers and internet biohackers constantly promote as the ultimate longevity miracle. Something my father adopted because he genuinely wanted to take control of his health. He read articles about it, watched countless videos, and practiced it religiously every single morning for 8 months before it nearly ended his life. Taking an ice-cold shower or doing extreme cold exposure immediately after waking up. My father had been watching videos praising the supposed benefits of cold exposure: increased alertness, fat burning, immune boosting, and reduced inflammation. Every morning he would roll out of bed, walk straight into the bathroom, turn the shower dial to maximum cold, and stand under freezing water for 2 full minutes, convinced he was investing in his longevity. On the morning he collapsed, he did that exact routine. He woke up, stepped into the cold shower, and the moment that freezing water hit his chest, his cardiovascular system went into total collapse. His heart stopped. Here is the terrifying science of what actually happened. When your body is hit with sudden, extreme cold, especially freezing water striking your chest, it interprets the shock as an immediate threat to your survival. Your body instantly triggers every emergency mechanism to protect core temperature, causing massive peripheral vasoconstriction. Thousands of microscopic blood vessels throughout your skin and limbs slam shut simultaneously, like floodgates in a storm. Think of your circulatory system as a closed network of pressurized pipes. When thousands of smaller pipes close instantly, all that rushing blood has nowhere to go, causing the pressure in your central arteries to explode. Clinical studies confirm that sudden cold immersion can spike systolic blood pressure by 20 to 40 points in seconds, and in older adults with baseline hypertension or cardiovascular disease, spikes of 50 to 60 points are common. For an aging heart and stiffened arteries, this sudden pressure surge is catastrophic, like trying to overinflate an old, brittle balloon. The risk of an arterial plaque rupturing into a massive heart attack or a weakened cerebral vessel bursting into a hemorrhagic stroke is extraordinarily high. But the cold shock doesn't just spike your blood pressure. It forces your heart to beat with violent intensity. To push blood through thousands of clamped vessels against massive resistance, your heart must pump significantly harder and faster. Myocardial oxygen demand surges to levels that narrowed coronary arteries cannot deliver, especially since most adults over 60 have silent, undiagnosed plaque buildup. When oxygen demand drastically outstrips supply, severe myocardial ischemia sets in. Your heart muscle is literally suffocating. This is the exact environment where lethal arrhythmias develop, particularly ventricular fibrillation. Deprived of oxygen, the heart's electrical system completely destabilizes. Instead of pumping blood, the heart muscle quivers uselessly, cutting off all circulation to the brain and body. This is sudden cardiac arrest, and without immediate defibrillation, it is universally fatal. That is the exact arrhythmia my father developed. The cold shock was the final straw on a cardiovascular system already strained by the morning surge, and paramedics had to shock his chest 4 separate times before his heart restarted. What makes this trend so dangerous is that morning ice baths and cold showers are aggressively promoted online by young influencers who have zero medical understanding of cardiovascular aging. A 25-year-old athlete with pristine, elastic arteries and low blood pressure can handle the shock. But for someone in their 60s or 70s with decades of vascular wear, that same shock can be lethal. The wellness industry has created a toxic mindset where more extreme automatically equals healthier. But aging physiology does not work that way. Older bodies require approaches that respect accumulated cardiovascular stress. In fact, my father had experienced subtle warning signs in the weeks leading up to his collapse: brief heart fluttering in the shower, moments of dizziness, and mild chest tightness. But he misinterpreted them as signs his body was toughening up and adapting to the cold. He thought pushing through the discomfort was proof of discipline. He was wrong. The medical solution? If you are over 60, avoid extreme cold showers or ice baths upon waking entirely. If you want the potential benefits of cold therapy, introduce it gradually over many months. Use lukewarm water. Drop the temperature by just 1 degree per week. Start by exposing only your hands and feet, and never blast freezing water directly onto your chest or head. And most importantly, if you ever feel palpitations, dizziness, chest pressure, or shortness of breath, stop immediately and seek medical attention. Leave a comment below right now with a single number from 1 to 5. How many of these 5 morning mistakes are you currently making? Be completely honest, because most people are making at least 3 without realizing the danger. Before I share the morning protocol that has kept my father safe and healthy for 3 years since his near-death experience, a quick medical disclaimer. This information is educational and based on clinical evidence, but it does not replace personal medical evaluation by your own physician. If you take cardiovascular medications like beta blockers, ACE inhibitors, diuretics, or blood thinners, lifestyle changes can influence your dosages, so always consult your doctor before making major adjustments. Now, here is the simple 5-minute morning protection protocol that saved my father's life. Step 1. The awakening minute. When your alarm goes off, stay lying flat in bed. Take a slow, deep breath in through your nose for 4 seconds, hold it gently for 4 seconds, and exhale slowly through your mouth for 6 seconds. Repeat this controlled breathing cycle 5 times. This sends an immediate calming signal to your autonomic nervous system, blunting the morning cortisol and adrenaline surge and easing your heart into wakefulness. Step 2. The hydration minute. Keep a large glass of 300 to 400 milliliters of room temperature water on your nightstand before bed. In the second minute, sit up slowly on the edge of your bed with your feet resting flat on the floor. Do not stand up yet. Drink the entire glass of water right then and there to immediately begin thinning your blood, expanding your plasma volume, and protecting your cardiovascular system for the day ahead.